Okay, I think we're getting pretty full here, so let's go ahead and get started. I just want to introduce myself. My name is Mimi Montgomery. I'm an associate editor here at Washingtonian, and thank you so much to everyone who's tuning in today for this panel, which is called Self-Care and Healthcare, Expert Advice from Top Female Doctors. And I want to take a minute to introduce all of our top female doctors who are with us here today. We've got Dr. Lisa Shah, who is the Chief Medical Officer at Live by Advantia and also a practicing primary physician. And we also have Dr. Meredith Kapner, who is an OBGYN with OBGYN Associates of Advantia. And she did her medical school and her residency here at George W., so she's very familiar with the area. And she's actually tuning into this conversation in between seeing patients today. So thank you so much, Dr. Kapner. We really appreciate it.
No problem.
And then last but not least, we have Dr. Heather Johnson, who went to medical school at Yale and is a partner at the OBGYN practice Ryder, Hill, and Johnson, which is also part of Advantia. So thanks everyone for joining us today. We really appreciate it. And a quick tutorial about all the functions here on the Zoom call. So we've got the chat function where you all can drop in a comment or give a shout out to our panelists here, but obviously please be respectful of everyone that is talking with us today. And we've also got the hand raise function, which you can use to give a shout out to someone who is speaking. But most importantly, if you want to ask a question, please use the Q&A box to submit it. You can go ahead and start doing that now, and towards the end of our conversation, we'll try to get to as many questions as we can. So let's go ahead and start our conversation today. And Dr. Shah, I will direct our first question to you. So women's healthcare is really multifaceted. It can often feel like we as women are juggling multiple visits with multiple doctors. How can women approach their personal care from a more holistic and streamlined perspective? And how does Advantia want to help women do this?
Sure, and thank you, Mimi, and thanks again for having us. It's such an important question. Women's healthcare is really challenging. Not only are we very different from our male counterparts physically, it's the one place where we actually are very different and we have very different needs. And as women go through their journey in healthcare, they not only need primary care services, but they also do need obstetrical and gynecology services, which are not integrated with primary care as it sits today. They also need mental health services, access to physical therapy, nutritional services. There's all types of services that are really critical for women to live their healthiest life. And you said it earlier, we're juggling many, many things, running around. Some of us, juggling a difficult career, a challenging career, raising children, taking care of our parents, our loved ones. So to be able to have to schedule 6 different appointments in a year to get the care we need is really not a fair onus that's being put on women by the healthcare system. So what do women need to do? I actually think we as a healthcare system need to change the model. And that's what Advantia is here for. We are working, our mission is to build integrated, comprehensive, and keyword for women, convenient care under one roof so that women can get all their care needs in one place. And that includes primary care services, obstetrical services, gynecology services. It includes mental health. It includes things like acupuncture and physical therapy. So we're spending a lot of time redesigning that model with women and their convenience and their complicated lives in mind.
That's awesome. Yeah. And I mean, I'm sure that's especially pressing right now during the pandemic when people are trying to decide, what is a visit that I can do virtually and what is something that I actually need to go in and see a doctor for. So Dr. Kapner, I'm interested, when you are working with patients and they want to come in and see their OBGYN, what are some appointments you say, you really should come in and do this in person? And what are some that women can probably feel a little bit more comfortable doing virtually now?
So that's a great question. And also I want to extend my thanks to having us here today. I've actually been doing a lot, and I think all of us have been doing a lot more virtual visits, and we're really expanding our idea of what can be done virtually. Obviously, there are things that you have to be in the office for. For example, there are certain parts of obstetrical care where we have to take lab tests, blood pressure checks, do a physical exam. That said, for things like contraception consults, conversations about preconception health, menopausal symptoms, abnormal bleeding, we can do an initial visit via telehealth and really reduce risk by having people stay home and be distanced while we're having these initial conversations. And we can kind of come together and decide whether it's time to come in and have an evaluation, say with an ultrasound or lab tests, versus continuing a conversation virtually.
Got you. Okay. And then for mothers who, are expecting, and, may be a little bit nervous about going into the hospital to give birth, what are some steps that hospitals and physicians are taking to really protect expecting mothers when they go into the hospital, as well as to protect the newborns after, a couple days afterwards when they're in the hospital?
Yeah, so, it starts in the office. I'd say in our offices and in our hospitals, we're making huge efforts to protect our patients. The first and kind of most obvious thing is we're all practicing distancing and using appropriate personal protective equipment in our offices and in the hospital. At this point, I can say with confidence that most hospitals admitting patients in labor and for any procedures, gynecologic procedures, we're actually doing coronavirus testing universally before people are admitted to the hospital so that we can appropriately manage patients, even with asymptomatic infections, meaning no symptoms with infections. Women who are laboring, we're really aware of how different this experience is for people. And the biggest change is having everyone wear a mask and limiting the number of people in the delivery room with our patients to socially distance appropriately. But we're really trying hard. And I think this is one of the things I want to convey to women is we're really, really working hard and I think really successful at trying to maintain the magic and the intimacy of childbirth, even amidst these changes.
Gotcha. Okay. And Dr. Johnson, I want to ask, if a woman is struggling with infertility and she's, regularly going in to see a specialist or is undergoing IVF right now, has the pandemic changed that process at all? And are any of her appointments going to be moved to like more of a virtual platform or anything like that?
Yeah, initially all of that stopped, and it's very frustrating for people to have fertility issues to begin with, and then to be ready to get started and then have a pandemic, and then maybe have to decide whether it's safe. Are you risking your life to try and get pregnant? Especially if you're older, if you're 38 or 39, you really don't have months and months and years to put that off. Fortunately, now with things opening up, that's restarted in a very thoughtful way and with lots of protection for the patients. Some of the visits are now telemedicine, and they limit the amount of times that there is personal interaction. But yes, that's back on track as much as it can be during a pandemic.
Got you. Okay. And then for women who are undergoing menopause, and I'll just ask this one to, our panelists here and whoever wants to speak up can. For women going through menopause, likewise, how can they be sure to prioritize their health during the pandemic? Are there any research showing that maybe this could affect women differently who are going through menopause? And likewise, what visits should they really prioritize making in person, and what can they feel comfortable doing virtually right now?
So menopause is a multifaceted area, and women are very vulnerable during that time, and they are having hot flashes, they're having irregular bleeding, they're having mood changes, they're having difficulty sleeping. How much of that is the pandemic and the stress that's involved with that, working from home, and how much of it is actually related to menopause. And fortunately, those kinds of things can be talked about distantly. You can talk to your gynecologist and set up a telemedicine to tease these things out. If you're having irregular bleeding, which does happen around that time, then that may require an office visit for an ultrasound or a biopsy or an exam. But many of the things about hormone replacement therapy, natural remedies, are you really depressed and anxious because there's a pandemic or because you're not sleeping at night because you're having tons and tons of hot flashes.
Mm-hmm. Yeah. And you brought up stress and anxiety a bit there too. And I want to talk about that with you all as a whole. You know, women do a lot. We're very busy and oftentimes find ourselves, you know, caring for a lot of folks at one time. You know, what would you tell a woman who really wants to try to prioritize her mental health, especially right now while there are a lot of factors at play? How can we as women really make sure that we're taking the time to take care of ourselves mentally and holistically right now?
Sure. I can take that question. I think right now it's a really difficult time for everyone. It's a difficult time for women. It's a difficult time for your children, your loved ones, your spouses, and the social isolation is real as well. Not being able to be with your friends, not being able to see your family, and to know that someone said it best to me, I could hurt somebody by hugging them is a really tough thing for us to get our heads around. And then on top of it all, we have to figure out, is it safe to get clinical care right now? Is it safe to worry about my cardiovascular health? We talk about menopause, but when we get there, women really need to be thinking about their hearts. They need to be thinking about how they can stay healthy. They need to be thinking about how they continue to get vaccines that are important, and preventative care and their mammograms. And all of these things are laced with a lot of questions. And with that lack of knowledge and not knowing where to go, the stress just compounds. So one thing we say is really trying to find time to take care of yourself. And what does that mean? Well, it really depends on who you are. For me in particular, I'll say that exercise is really important to me. So getting that walk in every day, whatever it takes, feeling like I'm doing the best I can to eat healthy, even though grocery stores are a stressful experience right now. Cooking, I might not be the best cook. Maybe I take up cooking and learn how to cook better. Whatever it is, we ask people to really find something that's about them, even if it's for 15 minutes a day. That's all. Just 15 minutes a day that is really about you. I think the other thing that's really important is knowing when to ask for help. And we encourage at Advantia Health, and in particular with Live, which will be opening in early 2021, having integrated mental health services. So Dr. Johnson in particular, I would love for her to talk a little bit about mental health, since that's something she does address regularly in her clinical practice. But making sure you feel like you can talk to any provider about your stress, about your anxiety, and ask for help. And that can be done over telemedicine. You don't have to come in person for that. That's, I think, really important, making sure we give access to talk to us and to talk to providers about these stresses and anxieties. Dr. Johnson, do you want to add on?
Yes, it's a particular favorite of mine. I wanted to be a psychiatrist back in the day, but I find OBGYN much more challenging and stimulating, but that part of my care for patients hasn't gone away. And I don't think that you can really take care of someone unless you take care of their emotional and mental needs. One of the strong points or things from Advantia is that they really walk the walk with this. And we have healthcare providers, mental health care providers available for our patients. And so you're having your GYN exam or your menopausal exam, or someone's had a loss in their family, and you know that someone really needs time to speak with someone about their issues. And that can be and is quickly arranged for a telemedicine assessment of what their needs might be, whether they need long-term therapy or just to be told, yes, this is normal, this is hard, you're okay, or whether they need medication. I don't think that you can do healthcare without doing mental health care.
Mm-hmm. Yeah. And I know we've talked a lot about telemedicine, you know, as a way for folks to feel safe during the pandemic, but also it's just, you know, I've been doing some doctor's visits via telemedicine, and it's just so much easier than not, you know, going into the office. You can just do it from home. But I'm curious, what are the steps that the women's health community and, you know, Advantia are taking to ensure that, you know, folks who might not be able to afford a laptop or a smartphone are still getting access to this sort of equitable way of accessing medicine right now, even if they may not have the technology to do so?
Yeah. Yep. It is, Such an important question right now. When you look at what's happening in the pandemic, the inequities in healthcare and the disparities, racial, ethnic, have been magnified. And, we at Advantia actually pulled together a task force, and the CDC just released their update on racial and ethnic minority differences for managing COVID. The number one difference as to why we're seeing worse outcomes is really access. I can't say it enough. If you don't have access to healthcare, you can't be screened for COVID. You can't be tested. You can't figure out you have it early enough so that you can take care and rest and do the things you need to do to fight COVID. And this has been around forever. It's not just COVID, but access is everything that drives the equality. So when you talk about internet and technology, and this is a hot topic in school systems too, right? And having access to technology, we have to find ways to do better. We need to be able to find a way to reach someone on a telephone if we can't do video. So a couple of things have happened since the pandemic. One, payers are now covering telephonic visits. And that was not the case before, but it's more important you talk to somebody, whether it's video or not. It used to be that payers would only reimburse if it was done, and by payers I mean health insurance companies for your healthcare insurance, if it was done over video. But now we're finding that telephone is covered. So if you can't speak to your provider because you don't have video access, you don't have a laptop, everybody in America has a cell phone or a home line. We know that. I mean, there is 99% of the population has access to a telephone line. So we can still do telephone visits. The second thing is smartphones. Smartphones are quite prevalent in our communities. They may not have internet connection, but there is, most people have functionality of a smartphone. All of our telemedicine capabilities can be done through your smartphone. So through your cell phone with video, much like FaceTime, but it's not exactly FaceTime. As long as you can connect through your smartphone, you can get a telemedicine visit. And I would ask Dr. Johnson and Dr. Kapner, but I would suspect the majority of patients are actually meeting with them through a telephone a lot of times because that's so much more convenient. I personally had a visit today and I used my smartphone. I didn't use my computer because I can't rely on my computer when 6 other people in the house are using the internet. So these are the other things that we have to think about too with homeschooling. The internet lines are unreliable. It's not just for certain vulnerable populations, but for all of us. So it's on the part of the healthcare system to figure out how you reach somebody when their FaceTime or their internet or whatever it is they're using as their device stops working. And that's usually by telephone or by phone number. And then opening up the offices for visits. We are seeing patients again. And we are taking every necessary precaution, as Dr. Kapner was saying, to protect our patients. We are screening our providers regularly. We are testing providers when they've been exposed or when we know about exposure. We track every exposed patient. We screen all of our patients. We use all the CDC cleaning protocols. So if a patient doesn't feel comfortable using the technology, because that's the other issue, it's not always access. Sometimes it's capability of feeling comfortable working with technology, which some of our communities, particularly some of our population who are elderly, are not as savvy with the technology systems that are there today. They can still come in and we are doing everything we can to protect them.
I just add a quick one to that is that I've been practicing a long time. So many of my patients are older and I have been absolutely amazed at the technical savvy of many of these people, 70, 80 years old. The only problem I had one time was a woman who had simply a landline. We couldn't understand why we couldn't get connected with her because she had a landline. So I held I had a telephone conference with her.
That's great.
That's awesome. She needs to give my mom a tutorial.
I was just going to say the same thing.
I actually have children have used their phone or who have a niece or nephew who've been able to use their smartphone to do a telemedicine visit with me too, which is pretty cool.
That is cool. And Dr. Shah touched on this a little bit about the inequities in healthcare and how we know that, the pandemic is affecting the Black population at a much higher rate than the white population. But simultaneously, Black women in the US are 3 times more likely to die during childbirth than white women. And Dr. Kapner, I'd like to ask you, what steps are you all as OBGYNs taking to ensure the safety of pregnant Black women during the pandemic right now?
It's actually fascinating what's happening in the medical community right now. I think the biggest change that I've noticed in my relatively short time in practice is just these conversations finally happening. I think it is such a huge step in the right direction to actually just talk about this. I've had more patients, Black, Hispanic, other minority patients, come to me and say, what are you doing differently? I know that I'm at higher risk. What steps can I take? And those conversations, I think, are so powerful. I think a lot of this depends on where you are in your population. The reality is the Hispanic population in our area is at even higher risk with COVID. And a lot of that is access to care, as we've discussed, risk exposure in work environment. So, one of the things I've been doing pretty regularly is having more conversations about what is your work like? Do you have to go in? Do we need to be talked? Do I need to personally call your boss to make sure that you have adequate personal protective equipment? Do I need to write a letter specifying that you're pregnant and that it is considered unsafe if you're unable to socially distance and you need to be doing something differently? And a lot of it is also just making sure we're opening our eyes to different complications. I've actually been having, and I would love to hear what Dr. Shah and Dr. Johnson have to say about this too, but I've been having a lot of conversations with my colleagues that are minority practicing physicians to get their ideas as well. And I've been very kind of overwhelmed and impressed by how much of a movement is happening in the healthcare community, kind of paralleling what's going on in the country right now to try and turn these things around by doing more research and really opening our eyes.
Mm-hmm. Yeah, I would just say Advantia Health just launched a diversity, equity, and inclusion initiative for our entire organization, all 800 of our providers, staff, practices. Dr. Johnson's been playing a big role in that as well. And one of the things that's been really important for us is education to our providers and our staff. And that's everyone from billing to the front desk, to scheduling, to our providers, to our medical assistants, really understanding the differences in healthcare by ethnic group and by minority group, and understanding risk factors better, understanding housing implications. So 15 people living in one small space, and what does that mean in the world of COVID? Work. Great example, Dr. Kapner, right? Where you work is really where your risk comes. I mean, as a healthcare provider who is practicing, we are definitely higher risk, but so are our grocery store workers, and so are our individuals in the police force, and all of those people who are putting themselves on the front lines for us, our teachers, et cetera. So I think it's really important to look at the individual holistically and look at their social determinants, understand the things in their environment that are influencing their healthcare outcomes. These are not separate. They are all one big picture. Your healthcare is built not just by your body and your genetics, but it's your behaviors, it's your environment, it's your social exposures, it's your work exposures. And we have to educate our healthcare community to look at individuals with that lens.
Yeah, I think it's the acceptance of the fact that one size fits none, to be open and educate, which is what Advantia is doing for healthcare providers themselves, to be humble enough to understand that not everyone's life is the same as theirs. And eyes open, hearts open, and keeping abreast of all the information and just being aware every single time you see someone that there may be factors in their lives that differ tremendously from what the ideal is, and we need to address it one way or the other.
It's all part of it.
And for women who may not have been able to prioritize their wellness, their overall health, I know we talked about mental health, but their physical health as much for various reasons, and now are really wanting to make that a priority and make that commitment to themselves every day. What are some easy steps that you would tell people that they can take sort of right away? Because it can be kind of daunting, you know, if you feel like you're starting at the bottom of the hill and you know that you need to get healthier, but you don't know exactly the steps to take to get there or how to make the small changes in your everyday life to reach that goal. What are some easy sort of small steps that you would tell folks that they can sort of just make today to prioritize their physical well-being?
I think Lisa started that off the right way, saying, you know, give yourself 15 minutes. You don't have to go from a couch potato to an Iron Man or Iron Woman. I think we look at 20, 30 pounds that you have to lose and say, well, that's just too much, or I haven't exercised in months or years. So it's, you know, just start. Just go out your door, put your shoes on, and go for a walk. Or sit for 15 minutes and meditate, calm yourself, you know, empty your mind. Share with people, you know, by phone or some other way to feel human again. Listen to some music, you know, just it doesn't have to be a lot, and 15 minutes is, you know, a great start. We can move from there, or maybe that's all you have if you have children and elderly parents and a demanding job. You know, just take that, own it, and do the best you can with it.
I think that is so accurate. And the other thing is, I think for a lot of my patients recently, unhealthy behaviors are so easy to access when you're stuck at home or you're feeling overwhelmed or stressed. Things like smoking, numbers are going up. People are gaining weight sometimes or not as active as they want to be. Drinking, we know that numbers are going up across the country, and other drugs. So I think one big thing that people can also do is recognize that they have a partner in their healthcare provider. And a lot of the time, one great conversation for 10 minutes with your doctor or someone else that you trust, just to be like, what are we going to do to help you get over this? Or what tools do I have to offer you? Or can you just hold me accountable to cut my cigarette use down by half over the next week, and I'll check in with you next week, but I know that you're watching me in a way, and I care about you. Those conversations make a huge difference. And so don't be afraid to reach out to the people in your life that can help you.
Yeah, I agree, Dr. Kapner. One of the things you just said, I think when we don't feel great mentally, we don't know who to go to. This is a real challenge. We've said for years, I mean, it's in the media. Everyone knows this, that our mental health care system is broken in this country, and we don't have enough access. But I think what we're trying to tell women is that your primary provider, whoever they are, whether it's an internist or an OBGYN or, you know, a therapist, because you happen to have access to one, it's their job to tell you where to go. It's their job to fix it for you. It's their job to help you figure out where to go. It's not your job to find out who to call or to Google or get online or try to figure out who's going to help you. Because the truth is, all of us should be trained in that. We are trained in that, and we will get you to the right place. So just make the call. Make the call. Anyone in the healthcare community will be able to help.
And there's been a really big, to add to that, there's been a really big increase in mental health care access via telehealth as well. And I've been talking to my patients a lot about that. Our office therapist and a lot of other mental health professionals are actually accessible via telehealth right now, which is amazing.
Yeah. And going off of that, I'm curious too, you know, we've obviously talked a lot about, you know, technology and sort of like streamlining care for women. This is kind of, I'm asking you to hypothesize a bit here, but what do you think the future of women's healthcare looks like? You know, in 20 years, like what can we expect that to look like? Will women just have to go to one site for, you know, all of their care? Will we just be sort of meeting doctors virtually in the future? Like, what do you guys kind of think that we'll be seeing, you know, 2 decades from now?
Well, I can start out and say, if you told me a year ago every single practice in the US would be on virtual telemedicine, I've said no way, no way. And it took a pandemic, and we stood up 63 locations on telemedicine in 4 days. And it's because when you got to do it, you got to do it. Like, we have to. We can't not deliver healthcare. So what is the future going to look like? Well, technology's just burst since COVID hit. People are coming up with solutions for everything. And I think I used to joke with both Dr. Johnson and Dr. Kapner that we'll never do a pap smear virtually. But in 20 years, who knows? I don't know. I don't know what it's going to look like. I still think that, mothers still need to be examined once in a while when they're pregnant. They still need that physical exam. We still can't do pap smears virtually. We still need to come in for our mammograms. But I do think we're going to find that there's going to be a lot more care, whether it's looking at your heart rate or understanding your electrical activity, or are you at risk for diabetes, or lab testing at home, like being able to do your own lab testing. I think we're going to find that these things are going to continue to just explode from the technology. I think what's going to be important is figuring out how people have access to it, how they can afford it. How do you, just the simple thing of saying to a mother, you can do some of your visits virtually. Can you pick up a blood pressure cuff for yourself though? Because you can't miss your blood pressure. Well, if that mom doesn't have access to get one or can't afford to buy one, what are we doing to fix that? How are we as a healthcare community taking all of that and making it equitable? So while I think the technology is going to continue to grow, I do believe that we also need to figure out how to fund it and how to get it in everyone's hands and not create more disparities because some people can access it and others can't. So that's just one thing I would just caution us on, and when it comes to technology and how people can self-use it at home. And then finally, I think it's not just about visits and telemedicine. It's about how can you access your provider 24/7. So one of the things that's different with our model at Live is that we're building integrated end-to-end technology. So that, fine, you can schedule your appointment online, but then you can fill out all your paperwork. You can chat with your care coordinator. You can upload your insurance information. You can schedule your follow-up, or you can just get a quick check-in with somebody because maybe your baby, you noticed, hasn't been kicking as much for the last 24 hours and you don't know if you should go to the ER. So what we need to do is use technology to give people access so that they don't end up in the emergency rooms where COVID is rampant. And they don't end up, going to an urgent care and waiting for 4 or 5 hours because they don't know where else to go. And I think that's where we get excited about technology. It's access, it's information, it's education you can rely on. It's replacing the Google, do I have blank question, which so many of our patients do, and then come in panicking. So I think that's what I get excited about. And I think it will look very different in 20 years. Anything to add?
I think you're right.
Yes.
Yeah, we can do this panel in 20 years and chat about everything that's changed.
We should.
And we've also been getting some really great questions from our audience. So I want to take the time to answer a few of those. Okay, and so we have one question here where someone said, I was having trouble conceiving before the pandemic hit and things took pause. Are there things I can be doing now to help conceive before I finally get to meet with a fertility expert?
Yes, and I think I have this conversation a lot with my patients about what does it mean to be healthy pre-pregnancy and during pregnancy. And in our community, we talk a lot about, oh, don't eat this, don't do that, take a prenatal vitamin, make sure you're not ever eating, uncooked cold cuts, But the reality is that healthy women have healthy pregnancies and are more likely to conceive and stay pregnant. So the best thing that you can do is take care of yourself. And that means having a balanced and colorful diet, exercising regularly in a way that also is beneficial for your mental health. And exercise has been shown over and over again to be as good as certain medications for anxiety, etc. And managing your mental health, making sure that if you feel like you could benefit from seeing a therapist or even taking medication, that you've already gotten that kind of in order for yourself before pregnancy. I think that's the most important by far thing to do. And the reality is that many women struggle with fertility, and having a doctor who's on your side to talk you through your options, as we're now starting to do more infertility treatments again in the office, is such an important thing. And it's a very individualized process of determining care when fertility or when you're not getting pregnant and you want to be. It's so much, there's so many layers to fertility. I think most women have the initial thought, oh, there's something wrong with me. Half the time is something wrong with your partner. And most of the time we actually don't know why people aren't able to get pregnant. And I think that that's honestly quite a surprise to many patients. So I would say seek care early, have a conversation with your healthcare provider, and in the meantime, I often have patients make a diary of their health, to write down what they're eating, how they're exercising over the course of a week or so, and talk about it and see if you feel like there are areas where you could be doing a better job taking care of yourself and being good to yourself.
And just to add on to that question, infertility is reopening. So fertility expert offices are reopening now. And so double check and make sure that you can still seek that care, because even if it's done by telemedicine, you can still start moving towards those conversations as well with experts and reproductive endocrinologists. So they were closed for some period of time during COVID, but most of them are reopening now.
This is true. And I should also mention that many general OBGYNs will do initial infertility workups and can even offer some infertility treatments in their offices versus immediately going to seek care at an infertility specialist.
Okay.
It can be done by telehealth too.
Great. Thank you. We have another question here that I think, a lot of us probably will resonate with. But it says, for those of us who have put off routine care because of COVID, what are the things you're most concerned we're potentially missing by not seeing the doctor?
So I'm going to take the older women first. Your mammogram. I've had, phone conversations or video conversations with women in their late 50s and 40s who really don't feel comfortable the older they are coming into the office. They want to do their year's visit health assessment online, and that's fine. But if you don't want to come and see me, I'll talk to you for your visit, but I want you to get your mammogram. For women who have had abnormal pap smears or at risk, I want you to come in and get that done. If you're up to date on your pap smears and you just need a refill of your pills, we can talk about your interim health history. You're staying with your parents someplace far away, but you still need your pills. Fine, I'm okay with that. If you need STD screening, that you should not put off. If you're just having symptoms, pain, abnormal bleeding, whatever, then those are the things that you should make sure that you get.
Yeah. From the primary care perspective, I will say, I'll put it this way: cancer screenings, all of them. I don't care what they are. Don't put them off. We have worked way too hard in this country to bring cancer down. And I worry a lot that this pandemic is going to see increased rates of cancer diagnosis because we're not doing our screenings, we're not doing them regularly, and we're not educating. So please don't put those off, whether it's your colonoscopy, whether it's a pap smear, whether it's a mammogram, whatever it is, you have to get that done. It's really important. The second is cardiovascular care. So heart disease kills people more than anything else in this country. We have to be screened. If you have chest pain, don't ignore it. If you don't feel well, you're short of breath, something changes, yourself. Cardiovascular care is critical. And then the third one that I think we often forget about is mental health. And we've talked about it a lot on this call. Don't put it off. You feel sad, you feel something's not right, seek care. And those are the three things that I think we just have to keep at the front of our mind. And pretty much anything preventive. Vaccines are another big one. Flu is coming. We're getting close to flu season. And if this hasn't taught us anything, get flu shots. Super important right now to be thoughtful about protecting yourself, because flu and COVID is not going to be good. So.
The only thing I want to just add is that I consider contraception to be a part of routine healthcare and healthcare maintenance. And I definitely have seen unintended pregnancies in the last few months because people have put off getting their long-acting contraceptives placed, or have not come in for their refill of their birth control, or had a conversation about what birth control they'd like to use. And so these are conversations, like I mentioned before, that we can often do by telehealth. We are placing intrauterine devices and contraceptive implants in the office now, and I think we're doing a really good job of doing that safely in the COVID world. So these are things not to put off because they have huge ramifications for your health as well.
I think we have time for one more question, and this one is Advantia specific, but someone's asking, does Advantia accept Medicare, and does it have an office in or near DC? And can one keep her own internist but have her OBGYN with Advantia?
Yes, yes, and yes. That was easy. Yes. So we do accept Medicare. Almost all of our providers take it because you need to see your gynecologist and your OB. And we also do have an internal medicine practice. So we do, serve internal medicine. We have a couple of offices near DC. And if you go to our website, you can see them all. But Ryder Hill Johnson, which Dr. Johnson is a partner at and works at, is it located in DC, as well as they have an office in Virginia and one in Chevy Chase, Maryland. And then there is also Live by Advantia Health that's opening up in DC in January in the U Street district. And that's going to have primary care, OB, gynecology, everything. You can have multiple doctors. You don't need to just get your care with one group. We're trying to solve for that so it's simpler for you, but it's our job to integrate with other providers to share your plans and your care plans, and to make sure that if you have an internist in one place, you're in an OBGYN in another, that they're communicating. And we will make sure of that. That's our commitment to you.
Wonderful. Okay, great. Well, I think that might be all our time today, ladies, but thank you so much. I really appreciate it. Dr. Shah, Kapner, and Johnson, for sharing your time and your wisdom with us today. And a big thank you to Live by Advantia Health for supporting this event.